imagine being woken up in the middle of the night and being told that your patient has just stopped breathing. You have to run as fast as you can to their bedside and try to revive them. In addition, when you get there, the family is standing outside the door. They're very emotionally distraught. They're probably weeping, crying, begging you to do all you can to help bring back their loved one. Not only do you have to be able to think critically during all of this chaos and help do your best to revive this patient, you have to deal with the stress of that as well. Or, on a lighter note, imagine yourself being in the delivery room and delivering a baby girl and seeing her for the very first time. Imagine yourself handing her off to the parents and getting to look into their faces as they meet their new baby girl for the very first time. Or try to imagine yourself pondering over a list of symptoms from someone who's very, very ill and trying to figure out what they have. Not only do you have to pinpoint their disease or condition, you also have to figure out the best course of treatment for them. These are all things that a doctor does every day. Now, granted, some of the things that I just described are probably not things that every single doctor does on a day-to-day basis. Even doctors who experience this at some points in their career may not see this every day. However, these are all things that encompass practicing medicine. And ladies and gentlemen, this is the art of practicing medicine. Now, I've gained a deep, appreciative understanding for this through many different avenues of experience. When I was in high school, I had the great opportunity of volunteering at a hospital. I worked close by doctors and nurses, and I got to see a lot of what they experience on a day-to-day basis. Now, as time went on, I got more courage up, and one day I asked the physician if I could shadow him and just walk around with him for a day and see what he did. He said yes, and I got a lot of great experience through that, seeing what he did. Now that I'm in college, I actually work at a hospital as well, and my job requires even more patient contact at the bedside. I've seen many of the things that I actually just described to you a couple minutes ago, and I can tell that they were very surreal experiences, and they definitely contributed to a passion and a love of medicine for me. In addition to this, I've also conducted my own research because there are a lot of blogs and books out there that talk about what it's like to be in medicine, because doctors are very eager to share their experiences and contribute to an interest in their field. And rightly so, because medicine is very interesting, it's very integrative and dynamic. A person who thinks scientifically and critically, has a passion for helping other people in their most difficult moments, and has a fervent desire to uphold ethics and be compassionate, has the makings to be a great physician. In the next several minutes, I will discuss the job field of physician. First, I will describe the education that goes into becoming a doctor. After that, I'm going to explain to you why there's a shortage of physicians in the United States and why we have a growing need for people to become doctors, especially Christian ones. Third, I will explain the exciting and promising opportunities that being a doctor provides that allows you to grow in your personal experiences and, most importantly, as a Christian, it allows you to imitate Christ in your job. Let's take a closer look at this. Becoming a physician involves both rigorous academic and non-academic pursuits. First of all, you have to graduate from college with from high school with a high school diploma or the equivalent with a GED. The reason is that before even thinking about medical school, you have to go to college and get your bachelor's degree. Now, while you're an undergraduate procuring your bachelor's degree, you have to take specific requirements for medical school. These include taking courses in humanities such as psychology and sociology, and they also include studying specific science disciplines such as chemistry, biology, and physics with their respective labs. Now, a common misconception is that you have to major in science in your bachelor's degree to apply to medical school. This is not true at all, folks. And in fact, although biology and chemistry are the most popular pre-med majors, there's a growing interest in majoring in other things such as English literature or history or architecture in your undergraduate. All of those are fine, and it's important to major in something that interests you because you're going to be doing it for 4 years before you go to medical school. You might as well be doing something you like, and most importantly, if you have skills in those fields as well, and if you believe that you can shine more in them, it's better to do something like that because you want to stand out and you want to specifically hone in on the skills that God has given you. In addition, you also want to take the MCAT after your undergraduate degree. Now, the MCAT is short for the Medical College Admissions Test, and what that specifically does is it shows that you can not only make good grades in science, but you can apply your scientific knowledge to specific disciplines. Now, the people who run medical schools know that it's important not to just get good grades, but to be able to take scientific knowledge and apply it to specific situations. As a doctor, you need to be able to have limited information and to just dig around in all the knowledge you have and come to the best conclusion possible with a lot of supporting evidence for that. That's what the MCAT is designed to do. However, with all the academic requirements that I've just described, it's also important to point out that there are non-academic requirements as well. Specifically, volunteer work in different fields. So your extracurriculars are important because they demonstrate a spirit of altruism. And in fact, the American Medical Association lists having a background in volunteer work as one of the most essential qualities to becoming a doctor, because it's important to not only just say on paper that you love science and you want to use it to help other people, but medical schools are interested in seeing that you've actually implemented that and shown that you like helping other people as well. So once you complete your academic and your non-academic requirements for medical school, you can officially apply. So medical school is very grueling. It's 4 years of difficult classes, both in the classroom and in the clinic, getting that hands-on experience as a doctor, as a student doctor rather. Doctors will tell you that it is some of the worst 4 years of their training. Frequently you have to pull all-nighters, you go on sleep deprivation, limited contact with other people because you're going to be studying all the time. The classes are difficult and it is very easy to fall behind. That's why it's important to make sure that you are extremely dedicated to that. It's not okay just to like science and to be able to make good grades. You have to be extremely dedicated to this field and be cut out for this path and have a passion for it if you're going to make it through. Now, one of the things that I like to tell people is that the licensing exam for becoming a doctor, the USMLE, which you take in 3 different steps throughout your medical school experience, the training book, the practice book for that is called First Aid. And it's no wonder, because once you get through medical school and you do all this work, you're gonna need mental first aid for your brain because it is so difficult. So, as if college and medical school weren't enough, lo and behold, once you graduate medical school, good for you. You're now officially a doctor. However, it's not over yet. You have to apply to your residency. Now, you're probably wondering what a residency is, and that's a good question. So a residency is what you apply to, it's a program you apply to after you graduate medical school. And as a doctor, you have to choose a specific specialty that you want to work in for the rest of your career. That may be something like pediatrics or obstetrics, or it could be a surgical field such as orthopedics or plastic surgery. It can be anything you want it to be. However, just know that the worst is not over yet. Medical school may in fact be a little easier than residency and fellowship, because a lot of doctors will say that residency was the worst experience of their whole training process. You have to conduct research, you're going to be in the hospital for days on end, probably without sleep. You frequently work 100 plus hours a week. All of this for anywhere from 3 to 8 years before you're finally done. Now, when you complete your residency, some doctors immediately go into the field as an attending, practicing medicine on their own, or they opt to go for a fellowship. A fellowship allows you to subspecialize in whatever field you've chosen. So, for instance, if you completed your residency in orthopedic surgery, you might choose to obtain a fellowship in something like sports medicine to allow you to treat diseases and conditions specific to athletes, or maybe something like total joint reconstruction, in which you're going to be performing a lot of hip and knee replacements. That's what a fellowship is for. They're typically not as long, but they're going to be just as difficult. So afterwards, you are officially a practicing physician, but we cannot overlook the fact that this is a very long and grueling process. Many doctors don't get married until they're almost 30, and it's easy to see why, because with 4 years of college, 4 years of medical school, 3+ years of residency and fellowship, it can easily take anywhere from 12 to 20 years before you're done with all of this training. And you have to put your life on hold, and that's very hard to do as a young person. Which brings me to my second point. There is a huge shortage of physicians in the United States for various reasons. Now, I want to point out that a study by Marriott, Hawkins and Associates found that 87% of the United States hospitals are urgently seeking doctors. 87%. Folks, that is huge. And as important of a job as physicians have, this is something that needs to be addressed. So you might ask, why the shortage? Well, there are many different factors that play into this. First off, the years of rigorous training and education that I just described contribute to that. There are many people who may be potentially well qualified to become a doctor because they think scientifically, they made good grades in their undergraduate education, they enjoy helping other people, they might enjoy different aspects of the job. But if you look at the fact that you have to put so much of your personal life on hold, or it makes it difficult at least to do the young thing or do the things that many young people do, such as get married or have children in their 20s or maybe early 30s, that's very discouraging to a lot of people. So that's a turnoff, and a lot of times people in their pre-med career just choose to veer off the path and choose something else. And to be honest, I can't really blame them for that. A study by the American Medical Association in 2014 found a less than 40% medical school acceptance rate for first-time applicants. This is exceptionally discouraging if you consider the fact that many people have already completed their they've all completed their undergraduate education. Many of them have bachelor's, master's, or even doctorate degrees before they even apply to medical school. To go through all that schooling, 4+ years, to procure the debt that many people do, and to fulfill all the other non-academic requirements as well, taking the MCAT and things like that, just to not get accepted into medical school, that's very discouraging. And many pre-meds in college change their plans along the way when they learn about these stats or figure out that, honestly, they're not up for it ultimately. Now, looking more at the healthcare aspect of why there's a shortage of physicians, America's healthcare system is disintegrating in many ways. Insurance companies are becoming increasingly more difficult to deal with. Insurance is a very difficult thing, and a lot of healthcare systems have regulations that prevent doctors from practicing medicine the way they want to. A lot of doctors working in especially public hospitals are told who they can and can't treat, what conditions they can treat. They're pushed by the healthcare system to perform certain operations or procedures, even if they don't need to, simply because hospitals are there a lot of times just as a business. They want to bring in revenue, and they have to do that in order to keep their doors open. But sometimes this detracts from the true art of practicing medicine, which involves just putting the patient first and looking only at their needs and nothing else. So with this considered, it's easy to see why there's a shortage of physicians in the United States. However, I want to keep stressing the importance of young people who believe that they're cut out for it and have those qualities and attributes that I've just listed going into medicine. Medicine is very dynamic, but it's very challenging and difficult in a lot of ways. However, it's unique and rewarding in its own regards as well. And this brings me to my third point. Although the training to be a doctor is a long and stressful process, the career is rewarding in that it provides a unique opportunity to help people when they're hurting the most. More importantly, as a Christian, a doctor can show the love of God through his career. In Micah 6, the Lord instructs us to seek justice, show mercy, and walk humbly with our God. There are many instances throughout Scripture where Jesus demonstrates to us the importance of showing compassion for people who are hurting, and that's what he did in his walk. You know, he healed blind men, he helped lame men walk for the first time. He even brought Lazarus back from the dead, which, of course, we know as doctors, you can't ultimately do that by your own ability. But that instance at the very beginning where I was talking about someone who had just stopped breathing and they were experiencing a code, medicine has the ability, with God's help, of course, to bring back people, revive them whose hearts have just stopped beating. And that in itself is very miraculous. When you look at medicine from that aspect, in a lot of ways, whether you mean to or not, doctors emulate Christ in their work on a day-to-day basis. And most importantly, we're told that love is the most important attribute of all, according to 1 Corinthians 13. We love because God first loved us, and it's important to pay that back by using the skills that he gave us. And you can do that as a physician. So in conclusion, yes, the path to becoming a physician is very difficult and treacherous. Because of this, many people are turned off by it, and there's a growing need for doctors in America, especially Christian ones. The rewarding aspects of this job should encourage young people who think scientifically and critically, and most of all, those who want to help people by showing compassion for the love of God, to go into this field and use the skills that God has given them to make the world a better place. So, with all this being said, are you a bright student who enjoys the reward of conquering challenging courses? Do you have the passion for serving others and showing compassion and love to people when they're hurting the most? If you answered yes to these questions, then a career in medicine might be right for you.